That was U.S. President Donald Trump, as well as Vice President Mike Pence and a number of officials, as well as businessmen and women addressing reporters today. The president has declared a national state of emergency in the United States where the coronavirus is concerned. He says that frees up a lot of money, additional money to help address some of the consequences of the virus's spread. He also announced some changes to the way testing can be done. He claims that will expedite the process and allow more people who need to be tested to get tested. However, testing has been a huge problem in the United States so far. The rate at which those tests are getting done is far slower than other countries, for example, like in South Korea. I want to go through some of what President Trump said and then, of course, bring you up to speed on what's happening in this country. This is an extended edition of Power and Politics, and I'm Vashi Kapellos. I want to bring in Aaron Blake, senior political reporter with The Washington Post, as well as the CBC's own Katie Simpson. Hi to both of you. Thanks for being with us. I know you were listening through all of that. Aaron, I'm going to start with you. First of all, on this the declaration of a national emergency, what exactly does that mean?
Well, basically, it frees up $50 billion of government money to go towards these efforts without having to have Congress pass a bill. It also streamlines some of the procedures as far as testing, as far as getting things cleared before they can be deployed. This is obviously a very significant development because it's something that isn't invoked very often. The president did invoke a national emergency last year for the border wall. To build the border wall. That was controversial, of course. I think this is much less likely to be controversial because there is a bipartisan concern, obviously, with the spread of the coronavirus. The question, I think, from there is how much that freedom is now used to actually do things that are productive.
Katie, on the subject of sort of money and the idea of testing and all the stuff that the president claims will happen now, he also got a lot of questions about his own exposure to the virus. Can you tell me a bit about that and then also expand a bit on what he said? He said that essentially he will be getting a test. It hasn't been scheduled yet, but it was sort of a surprise answer.
Well, it leads to a number of questions about the message that is coming out of the White House, and it has been incredibly inconsistent throughout this entire process, and that relates to testing in the United States, whether the president is going to get a test, whether the president should be self-isolating because he may have been exposed in some places. Let's start with testing because that is the most urgent concern in the United States right here. As you mentioned, the United States lags behind a number of other countries, even lags behind Canada right now in the number of people that have actually been tested or the number of tests that they are aware of. Private labs don't have to report numbers, so it's really hard to gauge a sense of what's going on down here in the United States. Dr. Anthony Fauci, who is a leading public health expert, who was at that news conference and who's really been seen as a leading voice from a public health authority throughout this process, yesterday described the testing system and the way it sort of rolled out as a failing. And Donald Trump was asked today whether he takes responsibility for that, and he very clearly said no. But there have been problems with the testing. Tests haven't been rolled out fast enough. The CDC, the test they developed, had problems with it. And when it did roll out, it was not giving reliable answers. So there's been a series of problems after problems, bureaucratic regulations. So the testing that is needed to happen in the United States to get a sense of just how widespread this virus is, it hasn't been happening. So at today's news conference, we did hear a number of measures being taken by the Trump administration to try and combat that, announcing that they're partnering with the private sector to expand how many facilities can do the testing, where people can go and get the testing. They're setting up an online website so that people can go and do a survey and find out, okay, these are the symptoms I have, fill out a little survey, determine whether or not they need to go and get a test, and then the website is supposed to, this is what they say, the plan is, supposed to direct them perhaps to a drive-through location to get a test. They're expanding the number of drive-through test locations where people can go to really see if this is an issue. But then Donald Trump has said in the past, actually said it on March 6th, I can tell you exactly the day, March 6th, he tours the Centers for Disease Control and stands in front of the cameras and says, anyone who wants a test can get a test. He goes on to describe them as beautiful tests. People heard that information and went to go and get tested when they had symptoms. And when they went to their doctor or went to their emergency facility, a number of those patients who have been speaking very publicly, I interviewed one this week, had said, and another number of other news outlets have been interviewing these people who were having these stories of saying they heard public health or they heard the president, the Trump administration say, hey, we can get a test. OK, I'm not feeling well. I should just be cautious and go and get a test just to make sure I'm not carrying this. I don't have this. And then when they went to their healthcare provider, they couldn't get that test. That's a problem,
Right.
a consistent problem down here. And so the president today said he changed his tone. He said, well, we don't want everybody going to get a test. It's necessary or not necessary. And then when he was asked about whether he's going to get a test, he says, well, I have no symptoms, but I might just get a test because I might just get a test.
Yeah. So again, Aaron, a little bit of mixed messaging, I guess, to put it mildly. Can you, from your vantage point, tell us some of the, concerns where the administration's handling of this is concerned and what the wider potential public health impacts of those concerns are?
Yeah, so I think Katie's exactly right to focus on the testing aspect. This was a big development this week. The health officials have, in some cases, kind of danced around the idea that this is a failing. Dr. Fauci on Thursday really drove home that this was, in fact, a failing. He said, this is a failing. Let's just admit it. The question from there is, what does success look like? They're clearly trying to deploy more tests. But we also saw in the president's comments here that he is encouraging people who are not symptomatic to not get tested. He also said that there would be 5 million of these tests rolled out in the next month here. But he said that, and I think this is a quote, we're probably not going to need that many. The common thread here throughout the reservations with the president's handling of this is his almost incessant desire to downplay this. I think he views this in certain ways as a reflection of his own presidency. He's certainly worried about the impact it will have on the stock market, which has plummeted and now actually recovered quite a bit today. But even today, as we're now talking about a national health emergency, we saw the president at certain points during this press conference downplay this in certain ways, suggest that it won't get as bad as some of the same health officials who were standing around him indicated that it might. And you wonder if this is something that the people around him are trying to get through to him and just perhaps can't get him to sign on to.
Okay, a lot to watch for. I really appreciate both of you being with us this evening. Thanks to Katie Simpson and Aaron Blake. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.